Hello family, welcome to another beautiful edition of Annie Author's Vlog. In today's edition, I am going to be zooming into mental health disorder called bipolar. So if today's your first day watching me, you are in the right place and at the right time. Please hit the red button that says subscribe, turn on the notification bell, and you will be among the very first people that will be notified whenever I post something new. If you're a returning fan, follower, well-wisher, lover, thank you so much for subscribing and following me all this time. I really love and appreciate you. Mwah. All right, guys. So zooming into bipolar disorder very quickly. What is bipolar disorder? So according to National Institute of Mental Health here in the United States of America, it says that bipolar disorder is a mental illness that causes an unusual shift in mood, in energy activity, level of concentration, and the ability to carry out daily tasks. Bipolar disorder causes extreme high and low in mood. That's the mood swings. It can be very high in mania stage episode, or it can be very low in depressive episode. Okay, so there is high and low in terms of behavior, emotions. It causes instability in one's life, and that makes it very difficult for the individual to carry out day-to-day tasks. So according to mental health documentation done by Our World in Data, that's in 2021, it says that about 46 million people suffer bipolar worldwide, yes, globally. So it can be managed, yes, if you follow strictly what your psychiatrist asks you to do and also your psychotherapist asks you to do. You can manage bipolar and will live a lifelong normal life, yes, in a very good way if you actually follow the instructions and counseling and medications. We are going to look at signs and symptoms of bipolar in two different, when the person is in different modes. Okay, so that means when this person is in depressive mode and when this person is in maniac mode. So in other words, when this person is in depressive mode, this person feels sad, hopeless, irritable, down. But when this person is in the mania mode, so this person experiences what we call ADHD. So this is more like attention deficit hyperactivity disorder. This person is feeling very excited, overjoyed, high. This person is just like, ooh, okay? So when this person is in the depression mode, this person lacks energy, this person is down, unhappy. But when this person is in the mania mode, oh my goodness, this person will talk and talk. This person is a talkative, okay? So this person, in other words, has lots of energy, trying to act out. This person is very active when this person is in the mania phase. Again, when this person is in the depression mode, this person have difficulties concentrating, remembering things, because this person can't think, cannot act anything at all. But when this same person is in the mania mode, oh my goodness, this person is having raising thoughts, full of energy, of feeling great, have so many ideas, just feeling very important, so full of herself or himself. But at the same time, when this person is in depression mode, this person is feeling guilt, despair, this person have no faith in himself or herself, then you flip it around. When this person is in mania phase, oh my goodness, there's something we call delusional grandiosity. So this person feels very pompous, very important, imposing pretentious impressions, thinking that she or he is on top of the world, thinking that he or she can control the world, can make things happen, that everybody is looking at her. He or she feels very important, you know, has so much ideas, like it's only her or him or nobody, you know. So that's when they're in that mania mode. Again, when this person comes back to the depression mode, oh my God, so this person is feeling so delusional. This person is having hallucinations, you know, seeing things that are not there, imagining things that are not realistic. You know, this person is just like is very, very disturbed. This person is irrational. This person is illogical when this person is in this depression mode. But you flip it around. This person in the mania mode also feels this way, delusional. Okay, you know, this person can imagine things that are unimaginable, you know, trying to do things that are not achievable, you know, especially by him or her. So this person is like, yes, I can do. But in the real sense, this person cannot. That means this person is irrational, delusional. This person is illogical, hallucinating, okay? So again, when this person comes back to depression mode, this person lack appetite, is easily distracted, easily irritated. So when this person is also in the mania phase, because of the hyperactivity, remember to eat or drink. You know, this person can dance all day. This person can sing all day. This person can run around the whole village or community all day. Comes to the depression mode, this same person will be thinking about taking his life, taking her life. You know, this person can jump from on top of the roof without even having that fear that he or she can be harmed or injured. So this person doesn't have that mental capability to be able to look at things and know there's reality in this. This person is not in that mode. Then when you flip it around, when this person is in mania phase, this same person is making decisions or saying things that are not of any normal person's character. You know, this person is the kind of person that takes risk. Very, very risky person. Even in the for sexual lifestyle or sexual orientation, this person can do anything, eat anything, spend lots of money. If this person have money available to himself or herself, they can spend it anyhow on anything, even things that are not important. That means they are not mentally calculative. They are not articulated. So in other words, this kind of person needs to be guided so that they don't hurt themselves or hurt others in the process. We are going to look closely at the causes of bipolar disorder. So it's been gathered that there are no exact known cause of bipolar disorder. Several factors that may contribute to bipolar. Number one is biological differences. So bipolar people seem to have physical changes in their brains which are still uncertain why those physical changes exist. Secondly, there are genetic factors. So bipolar people has been traced to individuals that are first degree relatives, so such as your siblings, your parents. So this particular gene has been seen in these two people, that's your siblings and your parents. So bipolar disorder can be genetic, okay? So if your parents has issue like what I have mentioned, there's a possibility you might have that issue. If your siblings has it, there is a possibility you might have it. But again, the timing might be different in individuals, and also the level of mania and depression can be different in individuals. High level of stress. Yes, a death in the family, death of your loved ones, traumatic events, loss of job or property, divorce, extreme medical conditions has been linked to bipolar disorder. Drug and alcohol abuse have also been linked to bipolar disorder. So studies have shown that people that have bipolar, about 50% of them are individuals who have alcohol and substance abuse issues. Again, so that's why we need to stay away from substance abuse and alcohol abuse. So what are the complications related to bipolar? Yes, problems related to drug and alcohol. People that suffer from bipolar, most of the time, 50% of them are always abusing drugs, always abusing alcohol. So again, their mentality is irrational. So people that have bipolar have been linked to people who want to take their lives at all time. They always have these attempts of taking their lives, or they always have these thoughts of taking their life. People who have bipolar have damaged relationships. They cannot stay in a relationship. Again, if their behavior is up and down, their partner or relations, whoever they are with, cannot at all times be able to follow them or accommodate them. So again, this kind of people cannot maintain a relationship, any type of relationship, friendship, marital, work, church, any type of relationship. They can't handle it, okay, because of their behavior. Then another thing that have been complication linked to bipolar is poor work or school performances. People who have bipolar cannot keep a job. Again, going back to their behavior, the mood swing, the depression and mania. Again, people cannot be able to keep them as employees at work. And also they cannot even articulate or coordinate going to work and coming home perfectly well. And also school performances, if they are students, yes, they might not be able to study, concentrate to study, concentrate in classes, concentrate in the exams. Yes, because of the mood swing, they cannot maintain these activities. What can we do to prevent this mood swing, this high and low, this episode of losing it? What can we do to prevent it? So pay attention to the warning signs, identify your patterns, the triggers, family members or friends can help in this, because some of these people don't even realize it. But once you see that they're having these little symptoms that is coming, please help them to control. Make sure they take their medications as ordered. There are people who has it like a pattern. Maybe it comes during the winter, during the summer, during the rainy season. There are patterns that triggers it. So we need to know this pattern, and we need to at the same time prepare ahead of time to help these people to stay focused on their medications or psychotherapies. Prevent or avoid the use of drug and alcohol. So normally, even people that have no bipolar issues, when you dwell on drug and alcohol, it messes up your brain cells. It makes you not to think well. You become so irrational and delusional and illogical. So if you have bipolar issues and you still do drug and alcohol, you're going to totally lose it. So that's why you need to avoid substance abuse and alcohol. Then another thing is to take your medications exactly as directed by your doctor. So in this way, you will keep your mood in order. So take your medications as ordered. It's not like when you feel good, you stop it. It is a lifelong medication. Please take it as ordered by your doctor. Then how do we diagnose bipolar? So when somebody have a little bit of teko going on, you go and see your primary care doctor. So your primary care doctor will be the one that will examine you, do the necessary labs. Then your primary doctor can then refer you to a psychiatric who will totally diagnose you in this category of bipolar issues. So in other words, your primary doctor will identify any medical problem that may be causing the symptoms that we are having. So if it's bipolar or there is a medical condition that is triggering these bipolar-like symptoms, then your primary care doctor will be able to address it. To have a psychiatric assessment, yes. If your thoughts and feelings and behavioral patterns are not one of those that have been discussed, go and see your psychiatrist, so that this psychiatric will be able to deeply assess you, evaluate you, and question you, and give you a questionnaire paper to check mark what is going on in your life, what you feel and what your thoughts are like. From there, your psychiatric will be able to diagnose you. So there's also a mood charting paperwork, so that you take it home, you can chart and document your daily activities, what is going on, how you are sleeping, your mood, and this can also help to diagnose you and find adequate treatment. Then another thing that could be done in the psychiatric department is to give you a criteria for bipolar disorder. So there is this document, we call it DSM-5. Okay, so it's more like a diagnostic and statistical manner of mental health disorder. So this will help to check mark you to know if you fall into this category of bipolar by assessing you. So this was published by the American Psychiatric Association. So check marking that thing will help your psychiatric to be able to place a diagnosis on you and how your treatment will also go. How do we treat bipolar disorder individuals? This person is going to be put on medications, and these medications are going to be lifelong medication. So it's not a matter of I feel good today, I'm not going to take it, or when I feel bad, I will double dose. No, you take these medications as directed by your psychiatric. So this person is going to be taking mood stabilizer, antipsychotic medication, antidepressant, and anti-anxiety. So again, depending on how your psychiatric diagnose you, they will put you on these medications. Then another thing is to have a day treatment program, such as support programs, counseling. You know, you go to a support program with individuals that are suffering from the same thing you're suffering from. You can share experiences, resources, treatment options, and this just in case you didn't know much about what is going on. Somebody who might be ahead of you might be able to help you go through this and help you seek for resources and treatment options that are better maybe than what you have. Using substances, alcohol, drugs, you need to stop. That's another way of treating bipolar. Stop using drugs, stop abusing alcohol. Okay, so quitting these two, drugs and alcohol, will also help you to process and support yourself better. Hospitalization. So in other words, this is recommended if the patient or the bipolar person is behaving dangerously or feeling suicidal or having psychosis. You know, when this person is detached from reality, this person is taking so much risk, this person is at risk of self-harm or harming others, this person should be hospitalized so that the hospital will provide a calm, safe place for this individual to be stabilized and the mood to be stabilized, be it manic or depressive episode, electroconvulsive therapy. So this therapy is more something that will induce seizure on this individual. This is harmless. So in other words, it's going to change the brain setting of this individual, which will induce a brief seizure that will reset this person's brain. In other words, it will change the mood to a more normal mood. So guys, take a minute to examine yourself mentally and also be on the lookout for your loved ones, your neighbors, your church members, your colleagues. You know, there has been a total rise in mental health disorders, especially bipolar these days. Okay, so if you see somebody acting abnormally, irrational, illogical, talking, doing things and taking risks that are so abnormal, or spending so irrationally, be on the lookout and make sure you get these individuals the right help. So this is not a time that people will be saying, oh, that's the way she always talks, or that's the way she behaves. Some people are suffering from undiagnosed bipolar disorder. So these people need to get the right treatment. Where I came from, like in Nigeria, people will always think, oh, it's diabolic, okay? This person did it, okay? This person, but sometimes these individuals are suffering from bipolar disorder, be it diagnosed or undiagnosed. Again, we need to get to the right channel to be able to get the right treatment and at the right time. A lot of people are suffering from bipolar, but they are living in denials. The signs and symptoms are very, very obvious. Yes, so let's be careful with these individuals and make sure that we get them the right help and at the right time, and also that they don't harm themselves or harm others. Bipolar is real. It is real and it's on the rise these days. So again, thank you so much for watching another episode of Annie Otter's vlog. I really love and appreciate you. Please do not forget to like, share and comment on my videos. Hey, I'm Annie Otter. Love you so much. Bye guys.